Hey, good morning or good afternoon, folks. Al Mattingly, Davis County Judge Executive here, and we're getting ready to give you our weekly COVID update. And it's my pleasure to also introduce Dr. DuFrayne from Owensboro Health, who's here. And we're going to have a little question and answer session in just a second. I'm trying to pull up some information I want to give you on my phone. Had a pretty good day in Davis County today. We had 16 new cases reported in Davis County. There for a little while we were starting to approach the red zone, and we absolutely do not want to get into the red zone because then a whole new series of steps are being recommended by the governor. So let me quickly find what I was wanting. Here we go. Put my glasses on so I can read. So as of today in Davis County, we have had 1,978 confirmed cases. 1,709 of those cases have recovered. That means that we have 269 cases. If you take out the 30 folks who passed away, that means we have 239 active cases in Davis County. The good news is currently we have 6 folks that are hospitalized as a result of COVID, and 139 folks were ever hospitalized. You know, the 30 deaths that we had, moms and dads and grandmoms and granddads and a few young people as well, aunts and uncles, and those are deaths that were untimely. They were sooner than these folks needed to go. And I would just ask that we all take a moment of silence to remember those folks and their families. Now, Davis County has been doing relatively well last couple of days. Yesterday we had 30 folks, but overall we are still below that red zone, which is 25 cases on a 7-day average per 100,000 population. Davis County is just kind of easy to figure because we have roughly 100,000 people. So the cases are the cases when they're reported for Davis County. But an example might be if McLean County reported 10 cases today. McLean County has about 9,000 people. To get to that 100, you would have to multiply the 9,000 people by 11. You'd multiply their cases by 11. That would be the equivalent of 110 cases in a day's time. If McLean County had, let's see what they've had. They show 4 folks who have passed away in McLean County. Multiply that by 11, and that would be 44 folks who would have passed away there. So when we start looking at statistics and looking at how things are going, you always have to take everything that you see and read and hear and kind of analyze it, and also take things with a grain of salt. As you've heard me say many times, go to the professional if you're looking for answers. Certainly you don't want to go on the internet, on Facebook. Everybody's an expert there, and half the time the expert, what was the definition for expert? It's a has-been who's a drip. You know, that's usually the kind of information that you are able to get out on Facebook. So without any further ado, I don't want to take any time away from Dr. DuFrayne because we have a few questions that we're going to ask him. He's going to answer. I would tell you that if you have any questions, you're certainly free to call them in or text them in. Jordan, I guess if they're watching our Facebook, they can text or email them to you, and you'll get them up here to me. But if you think of something after this session, please don't hesitate. You can send any question to me here at the courthouse. That's amattingly@davisky.org, amattingly@davisky.org. Send it, post it on our Facebook page. I'll get it to Dr. DuFrayne, and he will be happy to answer it. So, Dr. DuFrayne, welcome.
Judge, thank you.
I would also say this, Dr. DuFrayne and I are approximately 10 foot apart. That's why we've taken the mask off. It's easier to talk
And I was actually going to say that also,
Okay.
because we're far enough apart. We are in a large room that has very good circulation
That
of
is
air.
correct.
So we're actually we're doing okay.
Let's just get right into it.
Mhm.
What are the common symptoms of COVID-19? What should the folks out here look for and watch? And how do you distinguish between an allergy,
Right.
the common cold, those kinds of things?
Okay. So the common symptoms for COVID, unfortunately, are the common symptoms of a lot of viral illnesses. So the biggest thing for COVID, and we're talking about when you first present with symptoms. Now, you can have symptoms for 4 or 5 days, and that may change. But when you first come down with symptoms, your first 12 to 24 hours, fever, 40 to 45% of people have fever as their first symptom. Cough, about 50% of people have a cough. Headaches, still pretty common, 35%. Myalgia, which is a muscle ache. So kind of like when you get the flu, you get muscle aches. Also about 35%. Difficulty breathing. So, and that's why I always say fever, cough, shortness of breath. Those are really the worrisome symptoms. So initial presentation, shortness of breath, 30% of people, sore throat, 20%. And two symptoms that are really unique to COVID are loss of smell and loss of taste. So you can have both of those together, or you can have them separately. Those account for about 10% of the initial symptoms. And if you have an acute loss of taste or smell, that's really, as far as we know, COVID specific. So we kind of know when we hear that, you're getting tested. Other symptoms, chills or shakes, runny nose, nausea or vomiting, diarrhea, fatigue, confusion, chest pain, or pressure. So now, if you ask me what are all the symptoms of the flu, I would read from this same list. And that's why there is no real way from you calling your healthcare provider, from them saying, oh, I've heard those couple symptoms other than loss of taste or smell, and you have COVID or you have the flu. So we frequently test when you start to come down with those symptoms. Okay. Now we're getting into flu season, so everybody who comes in for COVID testing is also flu tested at the same time, because we can't tell.
Right. You know, a couple of folks that I know, and back when this all began back in March, the common question going across Facebook was, can you tell me anybody who's had COVID-19? Do you know anybody who has had COVID or who has lost a loved one? And back then it was hard to say yes.
Yep.
Now it's hard to say no, because I know multiple folks, some people in my own extended family, some people in the work community. It's funny that you say taste and smell, because many of the younger folks that I know that had COVID-19, that was their first symptom,
right.
Loss of taste and loss of smell. But I guess one of the things that bothers me a lot of times is I hear this cough and difficulty in breathing. Typically, when I have a cold or when I've had the flu in the past, I didn't particularly have a problem where I was struggling to breathe. It was perhaps uncomfortable, and I was congested. But the cough, the dry cough, the hacky cough, that pretty much is predominantly with COVID-19.
Yes. So it turns out I was away probably the end of September, just for a short period. But when I was away, I developed a typical cold. For me, it was a typical cold. I was stuffy, I was sneezy, I had a little bit of sore throat, and as I typically get with a cold, I get a cough. So by the time I got back to the hospital, everything was good, everything I had resolved except for my cough. And I thought, I'm going to have to get tested because I can't go back to work, sitting in meetings, coughing away. I think I'd have people running out of the room. So I actually got tested and I was COVID negative, but it shows you how difficult it really can be. So a lot of us get a cough during it, but typically with a cold and a cough, you don't get short of breath. Right. And that's really the key. And short of breath is really what distinguishes between a mild case and a moderate case. So if you just have fever, headache, sore throat, you're breathing okay, and we measure how much oxygen is in your blood, If you're not having any breathing problems and your oxygen level is above 94%, you're mild. We send those people home. We educate them, we let them know what to look for, and we'll get into other things like how do we take care of people at home in a minute. But that's mild. Once you get shortness of breath, you need to call your provider right away.
And when we talk about shortness of breath, I'm 73, relatively good shape. Every now and then when I run up the steps to the second floor, I'm a little short of breath, but if I stop, if I slow down, in a couple minutes, I'm back breathing normally.
Right. That's not shortness of breath.
That's correct.
So shortness of breath is I'm sitting in my chair at home watching TV, I'm not doing anything, and I'm really having a hard time catching my breath.
Yes.
I really feel like I'm short. So that's shortness of breath. Exercise induced, you run around the block, you run up the flight of stairs. Unless you're a marathon runner, we're all going to get short of breath. So, but you're right. Within 2 minutes or so, you're back to normal.
So, there's a lot of concern about when they should get tested, and I think you've answered some of that. But I've had some folks who told me that they had some of these symptoms or none of these symptoms, but they wanted to get tested. And in some places they will get tested. Some places will say, no, unless you're showing, unless you're presenting symptoms, we're not going to test you.
Right. And that's, unfortunately, that's still the state of affairs in most places because of the testing shortage.
Right.
Ideally, we'd have enough tests that we could just test the population. That's how we're really going to know how many people really had this. So to this day, we still don't know, because if you have no symptoms, unless we test you and you're positive, we don't know how many people had it.
Tell me about the test, types of tests, and you hear people, I'm not going to do anything until I can have an antibody test.
That's a great question.
So tell me about the different types of tests and what they're actually looking for.
So the three main tests are, we actually check for the virus. That's called a PCR test. That is, you come in, we swab the back of your nose, we go all the way back. Having had that test, and the nurse who did it for me did a great job. She's like, I'm going to stick this all the way back. It's going to be uncomfortable. I need to keep it there for 5 seconds. She put it in, and she was right. It's not painful, but it's uncomfortable. Yes. And she counted 1, 2, 3, 4, 5, and she was done. It was a great test. So that's the PCR test, and that is the standard for diagnosing active COVID. The second test is called an antigen test, and a number of places are doing that, but we don't recommend it, and all the national societies do not recommend it because the rate of it turning positive is really low, particularly early on. So some people say, oh, I've already been COVID tested. We look it up. It was a COVID antigen. We do not accept that test. We then have to test you to see if you actively have the virus. And that's through, we're looking for the DNA. We're looking for the genes. This case, it happens to be something called mRNA, but it's still a part of your the virus genetic makeup. That's active infection. The third test is the antibody test. So the antibody test, it generally takes around 2 weeks from the time you're infected to the time you start developing antibodies. So by 2 weeks, the vast majority of people, upwards of 90% of people, by 2 weeks, you're already over whatever it is you had. So you either have the antibody or you don't. So it could tell me, oh, you had the infection, but you can never use it for an active infection. So since you brought up antibodies, there's still this really big ongoing debate about antibodies. And there was a great study that came out just the other day from a really reputable organization. It was the Imperial College of London. It was a very good study. It had a few flaws, but a very good study. And they tested people in London and throughout England early on, and all the people who had antibodies, they then brought them back 90 days later. 26% of those people lost their antibodies. So again, it's an imperfect test, and we don't know what loss of antibody means.
Actually, it would seem to me that antibodies is a good way to gather data on what we do know and don't know about the virus.
And that is the exact way to think about it. So at the hospital, we actually did antibody testing on our team members who were in the kind of high COVID areas, the emergency room, the intensive care unit, and we wanted to see, so how many people really had this? The number of people with antibodies was so low, it actually really surprised us. So herd immunity, it's a great theory and a great concept. We're not sure in COVID that it's ever going to work. If you lose your antibodies, then
That's the scary thing.
That's the scary thing.
That is the scary thing.
Right.
So the PCR test accuracy.
Probably 98%.
Okay.
So-
Second test.
So if you come in for a test and your PCR is positive, we really know you have it. You have the symptoms, you have a positive test.
Right.
The 2% we don't really worry about. There are some false negatives for the PCR test, and the way we look at it is, if you really have the symptoms, we're treating you like you have COVID. We may need to test you again in 2 days, and that comes back positive actually pretty frequently.
Right.
So there's a little bit of a false negative, but we don't stop there. For the antigen test, particularly early on, you're talking maybe 70%.
Oh,
So
that's huge.
you can miss 30% of people who really have it. You go out in the community with a false sense of security, only to come back 3 days later and you have it.
Right.
So that's why we really don't use it.
And I know from just in the past, my grandmother back in the 60s had tuberculosis.
Okay.
My dad and I, and all the family, we were tested.
Mhm.
My dad and I tested positive. I will test positive for a
Forever.
TB
Yes.
skin test today. I don't have it. It's not an active infection, but I will show positive, and
Yes.
so did he.
And the way the TB test works is we test, so in the hospital, we get tested every year. And all it means is you were around someone who had TB, but you don't have an active infection.
Right.
If we really think you have an active infection, the first thing we get is a chest x-ray.
Yeah.
So there's a real difference between that. So
Okay.
great point.
And the rapid tests that we're hearing now, there are a lot of clinics that have rapid testing. I've heard as high as a 15% failure rate
Yes.
in that test.
And that was true early on. They're actually getting better.
Okay.
We use the rapid test still a fair amount. So if you come in through the emergency room and we know we have to take you to the operating room, you get a rapid test.
Okay.
So more and more companies, that's the wonderful thing about capitalism. More and more companies are making their
Right.
tests, and they're better vetted now
Right.
by the FDA. So that's one. That's the rapid test. And we can do upwards of 70 tests a day in the hospital just because we need to know now. So the other test, the standard, you go somewhere, you get a swab, and then we look for it. We get our test back in about 1.2 to 1.4 days.
Okay.
So if you're tested today at noon, typically I have your results back by Friday, tomorrow, about 4 o'clock.
Okay.
So-
And let me say, I was tested as well. I was exposed. Contact tracer called.
Right.
Thank
Mhm.
you, contact tracers.
Oh, absolutely.
And my wife and I were tested. We tested negative. I would say the test again. The person that administered the test did a great job.
Mhm.
The only discomfort that I suffered was a little burning.
That's what I had.
Just a little
Yeah.
bit. I didn't cough. I didn't sneeze. Just a little burn.
So I could tell it was there, and I
Yeah.
felt a little pressure and a little burn.
Yeah.
So you know it. It's not like a little Q-tip at the beginning of your
Right.
nose, but it's not. It would never stop. It really
Right.
should never stop anybody from having the test. It's not that uncomfortable.
So we think we've been exposed, and we go, maybe we get a test, but we haven't, and all of a sudden the contact tracer calls and says you have been exposed.
Yes.
Concerns: how long before I should go and get another test, and how long do I have to quarantine?
So right now, if we know that you have a serious exposure, the numbers do fluctuate on different websites and different societies that we use, like the Kentucky Department of Public Health, the CDC. So it used to be 14 days. Now we've got it down to about 10 days. But if you are informed that you have a serious exposure, you're in quarantine for 10 to 14
Okay.
days, depending on how serious your exposure was.
Okay. Now, how soon would I take a test to see if I had COVID or not?
So around day 5 to 7, somewhere between there, and we do that at the hospital.
Okay.
Obviously, we have people who are exposed. If it's a real serious exposure, we send them home. They're quarantined somewhere between day 5 and 7. We test them. If it's negative, and we do that because we know that the incubation period is about 2 to 14 days. That's the range. But on average, and it's a great average, on average, 5 to 7 days. So we test you at that time. If you're negative, we can actually bring you back to work and you take extra precautions and we walk them through those precautions. But just because you test negative before day 10 doesn't mean you're out of the woods.
While we're talking about that,
Mhm.
so I tested negative in the middle. My 14 days ends up. Should I get another test before I go back to work? A
No.
second confirming test?
No, so here's what, that was true early on. So we know if you make it past day 10, your chances of really having this are really, really small.
Past day 10 with no symptoms.
With no
none of the
symptoms.
things that
That's a
we're
great
talking
point.
about.
With
Yeah.
no symptoms.
Okay.
So I've been exposed, I get to day 10, I have no symptoms. Your likelihood of getting it is really minuscule. But there have been cases on day 12 and 13,
Right.
and that's why we continue to take those precautions.
Always outliers.
Yes.
I mean, always
Yep.
outliers. All right. So what if I tested positive and my 14 days is up? Do I get another test before I go back?
No.
Okay.
Again, it used to be, so there are two ways now of coming out of quarantine. It's symptom-based and or it's testing-based. So testing-based was at least 24 hours apart. You had to have 2 negative tests. But we now know there are a lot of people who are COVID positive up to 90 days. Doesn't mean you're infectious. It just means we can still detect little traces, but you're not infectious. And we know once you're over your symptoms, your ability to affect other people is now 0.
And that little bit of detection that you're getting is just the viral protein. That
Just the
you're
viral
testing
protein
for.
that's behind, not actually the virus.
Correct.
Correct.
So do you recommend a flu shot?
Absolutely, with or without COVID.
Right.
So here's my hospital ID, and I have my little orange
Yes,
tag. The color changes every year. This means I already got my flu shot. We, as an organization, were really so concerned for our team members that normally you get your flu shot by the end of November. Now everybody has to have it done by Saturday.
Right.
And you can tell at the hospital, if you have this orange tag on, that person has had their flu shot.
Here-
And we strongly recommend it.
Here at Davis County Fiscal Court, we offer the flu shot for all of our employees.
Mm-hmm.
We actually offered it the 1st of October.
Good, and that's what we did.
And I noticed that there are a lot of companies private companies who are offering the flu shot to the employees. Most of the time, if employees have insurance will cover it.
Right.
And if they don't have insurance, the company will pay for it because
Which is really smart.
it's smart.
It is very
absolutely
smart. So not only are you concerned about the person who works for you, but if you get enough people who are sick in your business, you could shut your business down for a month.
Shut it
So-
down. And not only that, the customer that
Yes.
you're working or
Yeah.
is coming in. So it's one of those things, one of those reasons we both need to wear masks. I'm
Yes.
protecting you, you're protecting me.
Absolutely.
Yeah.
So there's really good evidence that says you wearing a mask protects me.
Mhm.
There's more and more evidence now that says my wearing a mask protects me from getting it.
Right.
So yes, that's why we wear the mask.
Well,
let's go back to the flu shot for 1 second,
Yes.
because I do want to make one point. If I can make any one point right now, that is you cannot get the flu from the flu shot. I hear that all the time. Some people get a little achy with the flu shot.
Yeah.
Take a little Tylenol that night. If you can take Tylenol, and you'll do fine. But the flu shot cannot give you the flu.
It's pretty hard for you to catch a disease from viruses that are killed or
Correct.
dead. That
Already dead.
all you're getting is some pieces of viral coat
Right.
that causes your body to react and
Correct.
produce the antibody.
But we're exposing you to the virus protein,
Right.
and your body recognizes that as foreign. It's a protein that's unique to the virus. That's how the COVID vaccine we think will work. So we give you exposure to a protein that's unique to that virus, and your body then starts to say, oh, this is really foreign. This is not us. Start building up antibodies.
So, the people that you talked about who get a little achy, a little discomfort, typically they're reacting to some of the chemicals that are
Yes.
used to develop or
Right.
to grow the vaccine. And that's why you're asked so many questions.
Right.
Are you allergic to eggs? Are you allergic
Correct.
to this? So I know that I had a gentleman that asked me, did I get a flu shot? And I said, every year. I had the flu once when I was a teenager.
Mhm.
I never want to go through. Now, I've been fortunate.
Right.
You can still get the flu even though you had a flu shot because it could be a strain that's
Right.
not in there. But
Yep.
but he did. He took his first flu shot in probably 55 years. No reaction.
No reaction.
No problem.
Right.
But I had someone else who said, well, if we all wear a mask, there's no need to take the flu shot this year, is there? My answer was simply, well, that's my first line of defense.
Right.
So I have linemen on the football field, then I have linebackers, and then
Right.
I have safeties.
Correct.
So if the flu got by this,
Right.
I want to have all the protection.
That is
I
a great
can get.
analogy.
Yeah.
If I just had a nose tackle,
That's
then
exactly
they're going
right.
to score every time.
Absolutely.
Yep.
So
The other thing is when you get the flu shot, and this is what some people feel, as we mount an immune response, some people actually feel it.
Mhm.
So the cold, when you get a typical cold, most of the symptoms you get are not necessarily from the virus, it's your immune reaction
Right.
to the virus. So it could be that from the flu shot.
Sure.
You'll have that for about 24 hours, not the flu.
So if I get a flu shot, then I'm automatically immune from COVID-19, right? I don't have to wear the mask. I don't have to social distance.
Is that a test question?
That's a question.
Absolutely not. So getting a flu shot does not protect you from COVID. When a COVID vaccine is available, that does not protect you from flu or anything else. It's not going to protect you from the common cold.
Okay.
So,
Well, I know that you are a great seer of the future. When are we going to get a vaccine?
so it's interesting you brought that up because I just saw a news article today that Moderna out of Cambridge, Massachusetts, has already started lining up their supply chain and their agreements. They already have an agreement with the United States and a lot of European countries. They believe, so every time you go before the FDA, there is a committee that has to review your data, and they think that they'll have enough data lined up for the committee to start looking at their vaccine by mid-November.
Okay.
So now those things always take a while. And I would say from the time they start looking at it and the time you can get your first flu shot, 90 days would be a great window if everything goes well. So maybe by February or March, we may be seeing it.
I had seen a report from AstraZeneca who also had
Yes.
a vaccine in testing. I think they brought it out of the testing phase and are going to start producing it. So it looks like science
Yes.
has started, finally has caught up. What folks don't understand, I mean, we just found out about this disease in December, maybe.
Right.
November, December, just 11, 12 months ago. For science to move this fast is actually amazing.
So think about it when we were kids, how much polio was around
Mhm.
and how long it took Salk and other people to get the flu vaccine up and running. Then they converted that into a sugar tablet.
Right.
I remember taking those.
Oh, yes.
Yep. Then in the early 80s, we had HIV, and we didn't know much about that for a decade.
That's right.
It wasn't until really the late 90s that we got an effective antiviral cocktail that will really control that. So that was almost 20 years. The fact that from March until now, we're really talking about that you're in a testing phase for a vaccine in my lifetime is unbelievable.
It is.
Okay.
You know, I hear people talking about polio,
Mhm.
and I grew up in the 50s.
Right.
And they talked about, well, we didn't shut the country down. We didn't, quarantine. We didn't do this. Well, they weren't around my mom because in the summer,
Right.
we didn't go anywhere. We stayed at home. We didn't get out of the yard. I'm telling you,
Yeah.
we were quarantined.
Well,
We
that
were
always goes
quarantined.
back to that
Yeah.
saying, you got to listen to mama. Because
And-
I remember
and that's exactly
I grew up
right.
in Philadelphia, and in our neighborhoods,
Yeah.
all of a sudden, you would hear, oh, there are 3 people in a fairly wide
Yes.
area, but 3 people who came down with polio. And all of a sudden, boom, we were off the street.
Oh, I'm telling
You were in the backyard, you got exposed to no one. So they kind of knew how to do it back then, and it really protected a lot of people.
So, Dr. DuFrayne, do you have a message for our local businesses in terms of masking and sanitation and how they should be responding to this? And then I have a message as
Mhm.
well, but and not just local businesses. Let's
Mhm.
talk about our people in general,
Right.
The
So-
population in Davis County.
Let's start with our businesses.
Mhm.
And I can tell you, as I'm out and about in the community, I am really encouraged because I can't tell you how many businesses I go to now that have the sign on the door. You need to have a mask on to come here, to enter. I've seen people actually sent out of businesses without a mask. So the businesses are starting to get it. They have to protect their employees and their customers. There's nothing worse for a business to say, oh, I went to business X and 3 days later I had COVID, and
Right.
contract tracing shows me that's where I got it from. So businesses are really starting to get it. So have your customers wear their mask, clean your place, clean your tables, clean your counters. I'm encouraged to see that a lot of places now, I was at Home Depot a little while ago, and you can't get anywhere near the cashier. They have their plexiglass at the end of the counter, and they have a card reader on a cart that you don't even put your hand behind that.
Huh.
So it's like, okay, Home Depot figured it out.
Right.
So have your customers wear a face mask. You have to be very diligent in your cleaning. And a lot of places still have the signs on the floor, stand here 6 feet apart. I voted last Friday. What a great setup. Everybody was masked and doing exactly what they should be doing. And you saw the little circles on the floor, and just watch people do it.
County Clerk McCarty and Richard House, Deputy Clerk Richard House, have really done a good job
They
in
have.
setting up our early voting
Yes.
and setting up large voting centers for
Yes.
election day.
So I went to Burke's at the old one,
Yes.
and there wasn't a line. I was in and out in 20 minutes. And even the way they had the voting booths set up,
Mhm.
I don't know how far apart, but it was probably 10 or 12 feet. I felt very comfortable.
And after
in
you're
there.
there,
Yeah.
somebody is wiping it
Somebody's
down.
wiping it down.
So
And that's
they're-
exactly
yeah.
what you should be doing. So they did a great job.
Okay,
So now let's talk about the individual.
right.
So it's the same message that we've been putting out time and time again. The mask works. The more and more we gather data and the more we study it, we know that countries that went to adopting a mask early and their citizens really did it, they had incredibly low rates.
Mhm.
The countries that didn't do it, let's talk about the country that was the great failure, Sweden. Sweden said they had an epidemiologist in their country who ran their program, and he said, nope, we're not doing anything. We're not shutting down. We're not wearing masks. We're going to go for herd immunity, and we'll be fine. And within about 3 months, Sweden had to come out and said, that experiment failed. If we took these measures, we'd have been much better off. So wear your mask. Everywhere you go, wear your mask. Wash your hands. So this virus can live on surfaces like this for a long time, days. And we also know now that the virus can live on your skin for 9 hours.
Mm.
So wash your hands. Wash your hands frequently.
Right.
If you don't have soapy water, use a hand sanitizer with a minimum of 60% alcohol. 70% is better. We know at 80% it kills all the viruses within 15 seconds.
Okay.
So social distance. It really works. What we've noticed is the majority of patients who are COVID positive and come down with the symptoms really get it from a household contact. So that means you're close together, poor circulation. We're going into winter. Air conditioners aren't being used. Windows aren't open. So you, even in your house, you really need to be as distant as much as you can.
Well, I want to be respectful for your time. Jordan, do we have anything? You know, you bring up a great point. So someone in my household comes down with COVID, mom and dad and 2 children. How do you handle that? I mean, you know, they're going to be in the house. We have to be in the house. Somebody has to help them, particularly if they're sick.
Right.
What do you do?
So first of all, this is all dependent on what your individual resources are. But we always tell people, if you can, so if mom comes down with it, mom should not be cooking dinner and doing all the other things. Mom should be in another part of the house, in a bedroom. If you have a TV, great, you're keeping yourself entertained. If you have to leave the bedroom, then you put your mask on. If you have a separate bathroom, that person uses that bathroom. If not, you have to break that bathroom down a lot. Bring the food to the room if you can. And I have a lot of families who we've had to steer through this, and they've learned. They prepare their meal. They put a meal on a tray and put it outside the bedroom door. If the person has to come out of the bedroom, they mask up. If they're really sick but not sick enough to be in a hospital, their caregiver always wears a mask when they're around them. You don't want the whole house taking care of them. Designated caregiver, and that person is masked up, and the person who has it is masked up, and that really minimizes spread throughout the household.
I don't remember the exact statistics now, but it seemed to me that if you wore a mask and I wore a mask, it reduced by about 98% our chance of transmitting.
It actually does.
Yeah.
So if you are 6 feet apart and you both have a mask on, there's actually a nice algorithm that the Commonwealth just put out that actually walks you through that. So if the person with the virus has a mask on, then you go down this one tree. And if you have a mask on, then the next box says you're not infected.
Yeah.
That's how confident we are that mask of both people actually works.
Really neat when you follow the science and not what's on Facebook or the internet.
Correct.
Right?
Oh, absolutely.
Well, again, I just wanted to emphasize how much we appreciate you being here. This Saturday, my son and I, we have our favorite holiday. Really,
Halloween.
I can remember my son when he was 3 or 4 years old. I'd take off work early, carve a pumpkin on the front step, and we just loved it. Hocus Pocus, Bette Midler, and that bunch is my favorite Halloween movie. In Davis County, we have not said that you can't go trick-or-treating because I think Mayor Watson and I both realized that we could say don't go trick-or-treating, and they're still going to go trick-or-treating.
Right.
But if you do it, we want you to do it in the safest way possible. And what that means is do it as a family unit, right? Don't grab a bunch of folks from all over the neighborhood and go in large herds. Do it, the couple kids, the 3 kids. If you're going to give out candy, set a table out.
Yes.
Package the candy individually. My wife and I will stand behind the screen door or the glass door and watch the kids.
Yep.
When you get home, wipe the candy down.
Yep.
I mean, wipe it down. And if I've heard some people say, well, you can't wipe down Rice Krispie treats. Well, you shouldn't really be giving those kinds of treats out anyway.
No.
So
I actually saw a great cartoon the other day, and it was a mother in a costume and a child in a costume walking away from somebody's house, and the child has the thing in her hand, and she's like, yep, another hand sanitizer. That's what they were giving out. I laughed when I saw that. I thought, good, they're getting the message.
Well, the other thing that I want to talk about again, Davis County is doing relatively well compared to a lot of our other grad counties. A lot of our grad counties have slipped into that red zone.
Yep.
A lot of them, a direct result of the number of cases that are coming out of our assisted living homes. Now, somebody said something to the effect, well, if it's in the assisted living, those people aren't out spreading it. Yeah, but it's the people that are taking care of them that brought it in because it didn't spontaneously come into existence. So it really is a measure of how much COVID exists out in the community. And it's important that we don't drop into that red zone because the Frankfurt has come out, Dr. Stack and the state health department have come out and said that if we go into the red zone, that employers need to allow employees to work from home as much as possible, that non-critical government offices would close and do their jobs, that to reduce in-person shopping, order online, or curbside pickup to minimize that personal contact, order takeout, avoid dining in, prioritize businesses that follow and enforce mask mandates and other guidelines. And there are some folks who I don't want to call them mask shamers, but they will get on Facebook and they will say, I was at X store and they allowed people in without a mask. Reschedule or postpone or cancel any public or private events. Do not host or attend gatherings of any size. And that's hard to do. I mean, if you have a friend, a couple of friends who are going to go to Florida over the weekend and you want to go out to dinner, they're saying don't even do that.
Don't even do
now.
that, right?
And right now we're saying 10 or fewer people at an event. Avoid any non-essential activities and reduce the overall activity and contacts and follow existing guidelines. Folks, the thing that we're trying to do, we don't want COVID to get a foothold in our community to the point that we are sending hundreds of people to the hospital. Because while Owensboro Health has done an excellent job and actually still has excess capacity, it can become overwhelmed very quickly.
Yes.
And that's the one thing that we don't want to do. If you can extend the illness for a time period without it getting out of control, yes, you are going to be under these criteria like mask and social distancing for a longer period of time, but you're going to have fewer people, I think, getting deathly ill, fewer people dying from it. So in the end, what Dr. DuFrayne wants, what I want, what Davis County Fiscal Court wants, and I'm sure I can speak for Mayor Watson on this in the City Commission. We want you to be safe. We want you to live as normal a life as possible. But this is real, folks. This is real. It's killing our citizens. It's making our citizens sick. And there is still many, many things about this disease that we only are beginning to understand.
Yes.
So, Dr. DuFrayne, I'll let you close it out.
So, Judge, I know I've said this before, but I really want to thank you for giving us at Owensboro Health the opportunity to really come out and get the word out to the public here in Davis County and elsewhere, because this is a great forum for having a short, quick message and to really help to keep the citizens of our county safe. Okay. So we really, really appreciate it. And as always, anytime you need, we'll be here to help.
Well, thank you, and thank you for giving us your time. Folks, as we have done in the past, we delayed today. Usually this occurs on Wednesday. Dr. DuFrayne was unable to attend, so we had it today. Next Wednesday, I believe that Clay Horton from the Davis County Health Department will be here, and Clay can probably give us a lot of information regarding demographics of those who are being affected, age, gender, those kinds of things, where we're seeing it, and what they're recommending. So next week, somewhere around 11 o'clock, 11:30, we'll probably be doing it. If you'll watch our Facebook page, Jordan Rowe, our communications director, will place that on the Facebook page. If you have questions between now and then, don't hesitate to contact us. So have a good day and stay safe.